I think it's an incredibly rewarding feeling when you know the answer to a question. I don't know if you ever watched Who Wants to Be a Millionaire, but I find it when I know the answer without using a lifeline, especially for a high dollar question, it feels great. In healthcare, often there's not clear answers to a lot of questions when it comes to medical billing. Today, I want to talk about some examples of ways you can find out if a bill might be wrong. Hi, my name's John. I'm your healthcare hacker and a seeker of answers. Before we continue on with this episode, please take a moment and like this video and subscribe to our channel so you can keep up to date with the latest healthcare hacks and ways to navigate our complex healthcare system here in the US. In a prior episode, we talked about ways to identify if a bill is 100% wrong. Unfortunately, while those are clear-cut ways, most are a little bit gray. I'm going to talk about two of those areas today where if you experience this, your bill might be wrong. Now, not guaranteed to be wrong, but there's a good chance it is. The first area where we see a lot of questions and issues around medical bills being corrected is preventative care. Under preventative care, for most of us, we should not have to pay anything out of pocket. It should be 100% covered by the insurance company. It shouldn't go toward deductible, copay, coinsurance. So if you have a preventative care visit, think annual physical, think vaccination, think a colonoscopy to check for cancer, that should be covered and you should have to pay anything for that service. Now, if you're asked to pay something, that could be wrong. First, you need to check to make sure that the service is actually a preventative care service. To do that, you need to go to the Preventative Care Task Force website. I've included a link below to the website. Typically, any service that has an A or B grade is covered as preventative by most health plans. Therefore, you shouldn't have to pay anything. So if you had that tetanus shot and you had to pay your deductible against it, there's probably something wrong. First thing you need to do is call your insurance company and figure out why you had to pay for it. Now, it could be it was a coding error. Sometimes they put the wrong diagnosis code on. They don't code it as a preventative care visit. Or it could be a charge code. They use the wrong charge code. Regardless, your insurance company should be able to point you in the right direction and figure out what needs to be done to correct that bill so you don't have to pay anything out of pocket. Now, another way you can tell that your bill might be wrong is using your EOB. Not a guarantee, but at least it'll point you in the right direction, or at least a red flag should go off your head if you see this. I grabbed a copy of one of my recent EOBs just to illustrate it for you. Now, I blacked out a little bit here so that you don't need to know what doctor I see. But if you see your charges equal what you owe, then there's a problem, right? You shouldn't see that. So in this case, if what the amount I owe was $304, because that's what my charges is, then I know there's probably something wrong with my bill. Now, why do I say that? Most insurance companies have negotiated contracts for in-network providers. So if you're going to an in-network provider, typically you don't have to pay charges. That's kind of the full rack rate. They always have a discount, or almost always. So if you're being asked to pay for charges, you're probably paying too much, or at least it's worth asking the question. I would call the number on the back of your insurance card, ask them to look at that claim and see if the amount you're paying is correct. Sometimes there is no discount, but more often than not, there is. If you're getting billed for preventative services, or if you're asked to pay the charges on your EOB, those are just two red flags to know something might be wrong. It's probably worth your time to call the insurance company and ask them to take a look at it, because it may very well be wrong and you might be paying more than you should. If you have any questions or comments about this episode, please leave them in the comments below. We'll try to address your questions in a future episode. And as always, remember to get the facts by joining us in the next episode of Healthcare Hacks.